Number 3, a 4-year-old boy has delayed motor development and chorioathetosis. He had normal development at birth. He chews his fingers and lips, which has resulted in tissue loss. He has arthritis. Serum and urine uric acid concentrations are increased. Which of the following abnormalities is the most likely cause of these findings? A. Adenine phosphoribosyltransferase transferase deficiency. B. Hypoxanthine guanine phosphoribosyltransferase transferase deficiency. C. Increased cellular turnover of nucleic acids. D. Increased conversion of hypoxanthine to inosine monophosphate. E. Phosphoribosyl pyrophosphate synthase deficiency. And the answer here is B. Hypoxanthine guanine phosphoribosyl transferase deficiency. First of all, what is chorioathetosis? This is the occurrence of involuntary movements in a combination of chorea, which is irregular migrating contractions, and athetosis, which is twisting and writhing. It is caused by many different diseases and agents. It is a symptom of several diseases, including Lesch-Nyhan syndrome and phenylketonuria and Huntington disease. So what is hypoxanthine guanine phosphoribosyl transferase? It's also known as HGPRT. It is an enzyme encoded in humans by the HPRT1 gene. So skipping some of the chemistry, its role in disease. Some men have partial, up to 20% less activity of this enzyme. HGPRT deficiency causes high levels of uric acid in the blood, which leads to the development of gouty arthritis and the formation of uric acid stones in the urinary tract. This condition has been named the Kelly-Segmeier syndrome. And Lesch-Nyhan syndrome is due to HPRT mutation severity members, and some mutations have been linked to gout, the risk of which is increased in hypoxanthine guanine phosphoribosyl transferase deficiency. And let's talk about phosphoribosyl pyrophosphate synthase deficiency. What is this? So what we're talking about here is this enzyme is involved in the synthesis of nucleotides, purines and pyrimidines, and cofactors NAD and NADP, and amino acids histidine and tryptophan, linking these biosynthetic processes to the pentose phosphate pathway, from which the substrate ribose 5-phosphate is derived. And skipping down to the clinical significance here, its role in disease. Because its product is a key compound in many biosynthetic pathways, ribose phosphate diphosphokinase is involved in some rare disorders and X-linked recessive diseases. Mutations that lead to superactivity or increased enzyme activity or deregulation of the enzyme result in purine and uric acid overproduction. Superactivity symptoms include gout, sensory neural hearing loss, weak muscle tone or hypotonia, impaired muscle coordination or ataxia, and hereditary peripheral neuropathy, and neurodevelopmental disorder. Mutations that lead to loss of function in ribose phosphate diphosphokinase result in Charcot-Marie tooth disease and Arts syndrome. So once again, the answer here is B, hypoxanthine guanine phosphoribosyl transferase deficiency.